Hello, everyone. My name is Diana Stewart, and I'm the president of Envirox, and I welcome you to our webinar on cleaning and disinfecting during an outbreak like COVID-19. Our phones are ringing off the hook with questions from customers and partners about the best cleaning practices for the coronavirus outbreak, and we are here to help you. At Envirox, we pride ourselves on being innovators and leaders in low toxicity, sustainable hydrogen peroxide cleaning technology. And we are champions of green cleaning. Our goal is to promote the interests of health and human safety. That is why it is our responsibility to provide you with accurate, thoroughly researched cleaning information and experience-based guidance that supports this goal. We know that facilities are safer and healthier indoor environments when they are cleaned with low VOC, low residue cleaners that have a low impact on the environment. It's important to remember that if a surface is not clean, it cannot be effectively disinfected. The goal of cleaning for health is to get the best cleaning results in your facility with the lowest toxicity necessary. Outbreaks are unique situations that require a more robust approach to cleaning and disinfecting. With that said, rest assured, most of the best practices are already part of a well-designed cleaning program. Your cleaning staff may only need to make minor adjustments. In this webinar, we are going to provide the following information: cleaning and disinfecting best practices to address the COVID-19 outbreak from our leading authorities, the CDC and EPA. Important differences between types of products labeled as cleaners, sanitizers, viricides, and disinfectants. How to determine if a product carries the claim to likely kill COVID-19. Recommendations on what cleaners and disinfectants to use and the logic behind using these options. Additional links to resources so you can stay current on new information regarding the current COVID-19 outbreak. One of the most important things to know as someone who is cleaning to prevent the spread of an outbreak is how the virus is spread. This can happen through airborne droplets, like those we release when we sneeze and we cough, skin-to-skin contact, exposure to a contaminated surface, and even through saliva. This means that your cleaning should focus on high touch points or the areas where people are most likely to contaminate a surface, such as a doorknob, faucet, handles, light switches, and toilets. Anywhere people are likely to touch with their hands as they move through a facility. Now let's get started with cleaning. You know how on an airplane, you're always instructed to put your oxygen mask on first before helping others. This is selfish. It ensures you can do a better job assisting others. The same holds true for cleaning staff. You and your team are the first line of defense against the outbreak. If you get sick, then one of the best weapons against the spread of a virus is weakened or even out of commission. Cleaning professionals come into contact with high traffic areas while they clean. This means staff should take proper preventative measures. Here are some steps the CDC recommends. Cover your nose and mouth with a tissue when you cough and sneeze, and immediately dispose of that tissue. Wash your hands often with soap and water or use an alcohol-based rub. Avoid touching your eyes, nose, and mouth, as this helps spread germs. Encourage cleaning staff to stay home if they are sick. If you have a cleaning worker who is ill, have them wear a disposable mask. Please note that the CDC is recommending that only those who are sick with the virus, show symptoms, or are health and home care workers wear masks. It does not recommend it as prevention. Providing your staff with extra gloves and masks may be helpful too. Now we'll cover recommended cleaning methods in the case of an outbreak. Cleaning helps contain the spread of disease and infections, and how you clean for an outbreak should be more robust. First, let's talk about the difference between a cleaner, a sanitizer, a viricide, and a disinfectant. The marketing around different cleaning products can be confusing. It can make it seem like these are interchangeable. One of the most common questions we get from new customers is about the difference between the categories, and that's why we've made this handy chart for you. A cleaner cleans. It removes, dissolves, and lifts dirt and debris. Not all cleaners are created equal. Many contain too much surfactant and leave residue. We recommend avoiding residue as it can often result in more dirt accumulation over time, among other issues. After cleaning, the next step is to use an EPA-registered sanitizer or disinfectant. Sanitizers and disinfectants actually kill germs rather than just removing them. Sanitizers reduce most of the germs, more than 99.9%, while disinfectants kill all of the organisms specified at least to 99.999999%. To be effective, sanitizers and disinfectants must be allowed to remain on the surface wet for the amount of time specified on the label. Virucides are useful when you're combating specific viruses. For instance, H2 Orange 2, hyperconcentrate 112, is EPA registered to kill 99.9% of the specified viruses in 5 minutes or less. This one multi-purpose cleaner can both clean and sanitize hard surfaces carrying those viruses. But remember, cleaning and then disinfecting is still a two-step process, even if you can use the same product for both steps. However, in an outbreak situation, you need a more specific kill claim and robust process. In an outbreak, after cleaning with one of our multi-purpose cleaners, you complete the process with your disinfectant in order to ensure that none of the organisms remain alive. For COVID-19, the disinfectant must have an emerging pathogen claim by the EPA to likely kill it. If dirt and debris are not cleaned away first, then the disinfectant can't get to the surface to do its job, and any remaining soil provides a habitat for the microorganisms to thrive. Some products carry a one-step disinfectant claim. That simply means the product is expected to have some level of disinfection for light soil loads. The soil still needs to be removed to ensure adequate disinfection. Most disinfectant products will specify pre-cleaned surfaces, including specific claims on one-step disinfection products. Be sure to read labels carefully and follow the EPA-regulated instructions. I cannot stress this enough. A surface with debris, body oils, dust, dirt, or even residue left from other cleaning products will reduce the effectiveness of a disinfectant. That means you may not kill the virus. Our recommendation for the best product and process for an outbreak situation is as follows. Clean first, preferably with a low toxicity, low residue, powerful hydrogen peroxide multi-purpose product. With Envirox's products, this means using the light-duty solution for most cleaning and then the heavy-duty solution for high touch points. Envirox is EPA-registered H2 Orange 2, 112 and 117, Fresh 118, and multi-purpose cleaners will provide a strong start for your cleaning process. Disinfect the pre-cleaned dry surface as your second step with a disinfectant that has the emerging pathogen EPA-registered kill claim. Apply the disinfectant to the surface and let sit wet for the appropriate time as instructed by the manufacturer. For your second step in an outbreak situation, we are recommending using a leading disinfectant wipe with the appropriate emerging pathogen EPA kill claim. At this time, Envirox does not carry the emerging pathogen claim on our products. And remember, for the disinfectant to work, the surface must be pre-cleaned, and you must keep the surface wet with the disinfectant chemical for the kill time stated on the label for the emerging pathogen claim. It's important to make sure the surface is both clean and dry prior to using the disinfectant. Different cleaners, sanitizers, and disinfectants must never be allowed to mix. So the reason we recommend disinfectant wipes with the emerging pathogen claim as the second step during an outbreak to likely kill the virus are as follows. 1, they are available from many sources, and in an outbreak, cleaners need them now. 2, wipes are not sprayed, meaning they do not atomize potentially harmful disinfectant chemicals that may be harmful if inhaled by cleaning staff or others. The training is pretty simple, and properly used wipes will actually reduce cross-contamination on surfaces and are immediately thrown away, which, in the circumstance of an outbreak, is preferred. We recognize that wipes are not the best environmental choice and that Envirox doesn't even sell them. But we also believe in a situation like an outbreak, our responsibility is to provide guidance that supports the best interests of our customers' health and safety. This is our priority today and always. So how do you know if a disinfectant has the correct kill claim for COVID-19? If you would like a third-party list of disinfectants, we've provided you with a link to the list of EPA recommendations for disinfectants expected to likely kill COVID-19 on our online Outbreak Cleaning Guide. For the emerging pathogen claim, product instructions vary by manufacturer, and so the manufacturer's recommendations should be followed in each case. It is based upon the most conservative time required to kill the more difficult viruses. So let's review the complete cleaning process one more time. First, clean, preferably with a low toxicity, low residue, powerful hydrogen peroxide multi-purpose product. With Envirox products, this means using light duty solution for most cleaning and then the heavy duty solution for high touch points. Disinfect the pre-cleaned dry surface as your second step with a disinfectant that has the emerging pathogen EPA registered kill claim. Apply the disinfectant to the surface and let sit wet for the appropriate time as instructed by the manufacturer. If you're introducing a new disinfectant to your cleaning staff, be sure the SDS training as well as the personal protective equipment has been updated accordingly. Additional cleaning tips to reduce the spread of pathogens. If someone is sick, suggest they work or recover from home. Source additional packages of facial tissue for the workplace. Make sure cleaning staff wears disposable gloves during cleaning. Please don't touch your face. Make sure hand soap dispensers are functioning and full. Make sure proper paper towels are available in the restrooms. Make sure trash cans have liners, and the liners with the soiled facial tissue and towels are removed frequently. Make hand sanitizer available to employees at the workplace. Properly clean and disinfect touch points more frequently with a two-step process. When mopping, change mop bucket water more frequently. Soak mop heads in heavy-duty red dilution after use. Rinse and hang dry between uses. As you can see, with emerging pathogens, the answers are not always crystal clear. We will continue to keep new information on COVID-19 updated on our website and recommend you go to the CDC at the URL on our online Outbreak Cleaning Guide. Please contact us if you need any assistance finding this information. For questions, you can always email our client relations team at enviroxinfo@enviroxclean.com. To visit our Outbreak Cleaning Guide, go to enviroxclean.com/Outbreak Cleaning Guide. Ideally, we've provided you with clear guidance and information on how to keep your facility clean and healthy in an outbreak situation. Thank you for joining us. And remember, wash your hands, cover your mouth when you cough. If you're not feeling well, do try to stay home. And always, always clean before you sanitize or disinfect. Thank you.